Should have read the memo. I don't have to speak directly into the mic. Okay, so welcome to the new Housing and Homeless Committee. You'll have noticed Cameron and myself are co-chairs, and we will start off with introductions. Mr. Littlefield.
Mark Littlefield.
Karen Bronga.
Randy Soul.
Cameron Perez-Verdilla.
Mike Braniff, Parks and Rec, and I know that Katie Skovic and Eva Gardner will be joining us in a moment.
Right. Excellent. And thanks. Okay, so you'll look at the agenda and you'll notice one change we made. And just for the record, we've been joined by Miss Brawley. We have taken out the initial audience participation. That's been remains at the end. So trying to make this more of a business meeting. We'll also review the committee's mission. So part of Cameron and I's goal is to get back to the swim lanes and the missions of each party involved in trying to fight our homeless situation that we're in, as well as stick to what each committee or each entity is capable of doing. For example, the assembly handles purse strings and legislation, but we shouldn't be operating shelters. So with that, I'm going to read real quick the Housing and Homeless Committee mission from the webpage. So the Housing and Homeless Committee focuses on legislative, policy, and resource allocation matters related to housing and homelessness in Anchorage. The committee serves as a key public interface for the Assembly on issues surrounding homelessness and affordable housing in collaboration with municipal departments such as the Anchorage Health Department, Parks and Recreation, and the Anchorage Police Department. It also engages the mayor's office, including the homeless coordinator, to align efforts and address community needs. Anything you want to add?
Yep, I do. Hi, everyone. So yeah, Randy and I this is going to be a fun experiment having Randy and I being co-chairs. And I think so far we've been pretty much in line. Lots of new things, new committee leadership, as you're seeing, new administration, new community homeless plan, the new anchored home plan. We have a new homeless coordinator that is coming soon to work with the city. And I think that the key for us is that these meetings become a really productive and really useful time for us to work on issues that relate to action by the Assembly, that give an opportunity to understand the actual plan that we're all working around and the progress to that plan, and to get really clear about the roles that we all play. And so that's part of our initial goal is to sort of reestablish that or confirm that. I did want to just give a big thank you to Felix Rivera for the incredible amount of work that's happened over the last few years, and really leading this committee and accomplishing a tremendous amount over the last few years. So just want to thank him. And we're stepping into some big shoes, and we're going to try our best to again use this time really productively. And just a couple of things I want to highlight, and that is that the name of the committee has housing in it, and I think that may be confusing at times because we have other committees that are working on things like increasing the amount of affordable housing and housing in general. And we can sort of wrestle through this, but in my mind, that the housing part of this committee, for me, lends more to things like transitional housing, supportive housing, rapid rehousing, federal assistance for housing. So really sort of the kinds of housing that relate directly to the anchored home plan and directly to us improving homelessness in our city. So I think that's kind of what I had to say just in terms of mission and purpose. And I think we're open to your thoughts about how to make this time in this committee more productive. So I think that's it for me. Great. Okay. And then do we have somebody from the Alaska Coalition to End Homelessness here yet? Yeah. Okay, great. Okay. And so would you mind coming up? Thanks. Yes. Oh, Miss Brawley.
Yeah, and just as we're making this transition, I appreciate you bringing up the point about housing, because I think that's something that this committee's talked about and we haven't fully kind of resolved, because there is the housing action plan, and a lot of that work is really pretty technical code work. I think that's going to go through the Community and Economic Development Committee. But just to put on the table as an idea going forward, one area that CEDC doesn't focus on that could be a discussion in this committee is basically a lot of the issues around affordable housing, but also just rent, tenant issues, right? The idea of keeping people in housing, all of those kind of issues that are separate from development of housing. So Mr. Rivera and I have talked about that in the past, but we didn't move forward with those ideas. But there are things in the housing action plan
Great.
that are also specific to that. So just to offer some ideas, and I'm happy to chat further, but just to
Yeah,
think about
no,
that.
I really appreciate that. And that's, I think that again, using the committees in a really thoughtful way and distinguishing what bodies of work we're working on versus others is really going to be helpful. Thanks. Any other members' thoughts about the mission as we move forward before we move on?
I'm just going to state apologies. I'll have to step out at 10 after.
Okay, great. I think that the plan for the agenda today is again to sort of reground us in our plan, reground us in the roles that people play, and to get some updates on how things are going. Also to hear from the administration on their initial thinking as we move forward around issues like abatement and camp management, emergency cold weather shelter, et cetera. And so we wanted to start with the Anchored Home Plan and have the coalition review that for us. I know many of us have read it and are familiar with it, but it'd be good to sort of reground us in that, and then also the data, the priorities, those kinds of things, and maybe an update on where we are. So please introduce yourself for the record. Thanks.
Absolutely. Thank you. My name is Jessica Parks. I'm the Chief Operating Officer at the Anchorage Coalition to End Homelessness. ACH is the Continuum of Care lead agency. So the Continuum of Care is the framework and all of the providers and housing services in the city. It's a HUD designated term, and what it does is manages the continuum of care funding that comes to our community. That continuum of care designates a lead agency. So that lead agency is responsible for kind of the staffing of that. The continuum of care is managed by an advisory council, which is their board, but none of those are paid positions. So there's a small planning grant that comes from HUD along with that to do kind of the administrative work. So Anchored Home is the COC's plan. This is something that the Anchorage Coalition and Homelessness worked together with the Advisory Council to create. The Advisory Council approves and adopts that plan, and the municipality adopted it at the last assembly meeting. Part of the plan is that we will commit to giving 6-month updates out to the community on progress being made, as well as some of the key metrics that we track to see how well we're doing in working towards ending homelessness, and a term called functional zero. When you've achieved functional zero, it means that the number of people that are entering homelessness and the number of people who are exiting homelessness have stabilized. So it doesn't mean that nobody ever experiences homelessness again. It means that it is truly our mission to make it rare, brief, and one time. So that person will bounce in and out of homelessness very quickly. And I do have a slideshow, and we will go through some of the reports and some of the data. So next slide, please. So just again.
Sorry, if I can interrupt you just for a second. Just want to remind members, if you do have questions, just let me know. You can text me or you can just signal that you want to ask a question. Thanks. Go ahead.
Yep. So as it was mentioned, and as you can see in the agenda, talking about Anchored Home Plan itself, looking at some of the data, a preview of the upcoming dashboard to have all of that reports back out, and then looking at some of our community's priorities and challenges, particularly as they fall under Anchored Home, and then private and public partners that have been part of the planning and part of the execution of Anchored Home so far. Next. All right. So looking at some of the key metrics at June 30th, 2024. So the number of people experiencing homelessness, this one is just kind of the North Star number. At the end of June 30th, 2024, that number was 3,080 people. I do want to highlight that it is the 7th consecutive month that we have had outflow exceeding inflow. So we've seen that number go down. Last month, it went down by 3, but that is still going down. So at the end of December, I'm sorry, that's a typo. December 2023, that number was 3,187. So we have seen that number decrease. Looking at the length of time homeless. So this is the amount of time that people spend experiencing homelessness in our community from the time they first enter homelessness to the time that they exit into a permanent destination. So looking at January, that median, or as of right now, June 30th, that median length of time homeless is just over 400 days. At January, so starting off this 6-month period, that number was 566. So we are making progress on prioritizing people who have been experiencing homelessness the longest to getting exits into housing or other permanent destinations. Looking at the percentage of people who are exiting to a permanent housing destination. So these are people who are entering homelessness and then exiting into permanent housing. 38%. The prior 6-month period was just under 37%. So it is an increase, but a really small one. One of the challenges with this metric is having good data. So if somebody leaves a shelter, for example, and they don't talk to someone, that shelter provider doesn't gather the information about where they're going, that they could have gone to housing, we just don't know about it. So one of the goals around this particular metric is getting better at gathering some of that information so we have better data on where people are going when they leave. And then the last key metric I'm highlighting here is returns to homelessness. So this is when someone has been housed in permanent housing, the percentage of people who then return back to homelessness for whatever reason. So right now that number is just over 8%. The prior 6-month period was about 7.5%. So we have seen a slight increase in returns to homelessness over the past 6 months.
Thank you. Before I go, I just wanted to make a couple comments. So a couple metrics that was suggested for this committee to focus on are how many did we house last week?
Okay.
How many stayed in housing, 3, 6, 9, 12 months? And then how many units did we add? Which sounds like that data is probably available. It's the first 2.
Yep.
And then is it going to be meaningful enough for this committee? We won't do it to do it by week. Could we do it by week? Does that change enough during that period, or?
It does. The challenge is just the data. So housing providers typically have a 14-day period to enter their data. So all of our data tends to run a bit behind, anywhere from a week to 3 weeks behind. So most of our data that we report is on a monthly basis. That would be much easier and more accurate.
Okay, that'd be great. Also with the continuum of care and ACH and the other organizations, is there a place where we can find like a spider diagram or an organization chart or something to help us to communicate to the public?
So the best resource to try to find like a service provider map or a system capacity map is going to be 211. So United Way runs our 211 system for our community, and that is kind of the holding place of all resources for people. So that would be where you would see some of those wraparound services as well. So food security resources would be there, legal resources would be there, but housing and homelessness services are there as well.
Thank you. Yeah, thanks. Thanks very much. Thanks, Mr. Stolt. You can continue. Thanks.
All right, next slide, please. And so right as Assemblymember Stolt is leaving, so looking at the anchored home plan under the first kind of strategic section, housing, supportive housing, and supportive services. One of our goals is to actively support the creation of 150 housing units per year. So far this year, housing units created have still been 0. But one thing I wanted to highlight was through the work around the next step and with United Way's landlord housing partnerships, we are creating landlord partnerships that allow units that weren't previously available to people experiencing homelessness to now be available. So landlords who may have had restrictions on who is able to rent from them in terms of prior evictions or criminal history have entered into that partnership and made those units available to people experiencing homelessness. So it's not new units coming online, but some of those units are units that were used for short-term rentals in the past and now are being used for long-term rental for people experiencing homelessness. And then second goal in that category, increasing subsidy and voucher access to people experiencing homelessness by 50%. So we continue to advocate for those set-asides. Right now, that support we are seeing through project and sponsor-based vouchers. So it's not a set aside of vouchers for people experiencing homelessness, but a set aside for projects that serve people experiencing homelessness. So it's definitely a step in the right direction. Next slide, please. Establish and formalize 100 partnerships with non-homeless service provider partners. So one of the biggest challenges we've had over the past few years, particularly through the pandemic, was that a lot of these partnerships and relationships that have existed were with people. And so as we've had turnover and some of those people have left, some of those partnerships have just gone away or not maintained the stability that they could. So working to try to formalize those partnerships so that they will outlast people turning over and they are formalized between relationships. And so we did have 3 new ones in the past 6 months. And then as we work through our continuum of care collaborative application process in the next few months, we will formalize all of the partnerships identified in there, which are around 50. And then increasing the integration of homelessness and healthcare services with formalized partnerships. We had no new formalized partnerships this period, but have had some great conversations. Next slide, please. The next category is data and coordination. So a goal of 90% of homeless service providers and 60% of emergency healthcare service providers using coordinated entry, and then 90% of funders requiring the use of coordinated entry. So at 6:30, that number was at 66% of homeless service providers, and right now no healthcare providers are using coordinated entry. But we do have 60% of funders requiring the use of coordinated entry. And the municipality does require it for some of the funding that comes through.
Can you help us understand the difference between HIMS and coordinated entry, please?
Absolutely. So HMIS is a data system that just tracks all of the information for programs that are serving people experiencing homelessness. So if you are interacting with our homeless prevention and response system, if you are accessing those services through an organization that is an HMIS participating provider, your information is in there. Coordinated entry is a program within HMIS, so similar to like how a shelter would be set up. When you interact with that shelter, you're in that shelter's program. So coordinated entry is the way that our community manages referrals into continuum of care programs. So if there is a program that is funded through that particular funding resource, in order to access those resources, you get a referral from coordinated entry. So coordinated entry is that system that performs that initial housing assessment and determines which programs you're eligible for, and then prioritizes based on vulnerability.
Ms. Braga.
I'm just a little confused because we voted for this and it seems like we're doing this opposite order. We should have maybe had a work session to figure out what we voted on.
Yeah.
Anyway, just a comment.
Thanks.
Okay. And then second goal under data and coordination, that 100% of people that are in AKHMIS have all of their relevant subpopulation information recorded. So sometimes when somebody is doing an assessment or they are enrolling someone in a project, they may not gather all of the pieces of information. And so then that makes it really difficult when we're trying to determine, a population that is a certain age or certain demographics. And so at the end of May, I did not have a June 30th number yet for this, but at the end of May, 77% of those enrollments were meeting those data quality standards. So solid C+.
Actually, I have a question for you before you move on. Mr. Constant.
Yeah, it's not a question. It's that we did have a work session and a briefing. It just was a while ago.
Thank you, Mr. Constant. Go ahead.
All right, next slide, please. And then the last two goals under data and coordination. The first one is to identify up to 5 methods that collect subpopulation information in a healing-centered manner. So right now, as I said, all of those intakes and all of those assessments are done really by reading questions off of either a piece of paper or off of a computer screen. So we really have a goal to try to take a trauma-informed approach as we ask those questions and figure out ways that we can really gather that information in a better way. And so one way that we worked towards that was offering motivational interviewing training to all of our access points. That was through the South Central Foundation so that we could really work on ways that you can ask those questions that aren't just reading off of a piece of paper. That's really hard to engage someone, particularly if you've just met them. And then the last goal is to formalize those relationships with state and local public agencies. So a goal of 100% of them and 60% of organizations that oversee prisons, child welfare, and healthcare to be able to integrate those coordinated entry assessments into their discharge planning. So we know one of the big challenges in our community is that people tend to be discharged either from correctional facilities, from child welfare organizations, or from healthcare organizations into homelessness because there isn't always a resource for them. So if we're able to get that information and get them into the system while they're still accessing that case management or that support service there, we can get that information better and get them moving towards a solution for them. So we have started those conversations with the prison, child welfare, and some of the healthcare organizations at this time to help start that relationship. Next slide. The third category is promoting equity. So the first goal is to increase the number of continuum of care lead organization staff and our advisory council members that have lived experience by 50%. So as of 6/30/2024, there haven't been any changes in staff or advisory council members. So there hasn't been any changes or increases to that number. But that's really important that we are working towards having people who have lived experience and expertise not just represented in these organizations, but in decision-making roles. And so that's a goal that's in Anchored Home.
Before you go on, just a clarification. So you have the ability to understand the demographics of the staff of all of the agencies involved in the continuum of care?
No, this goal is just the ACH staff, essentially, COC lead organization staff, and then the advisory council members that are the board of the COC.
I see. Okay. All right.
I think in a perfect world, we would be able to, as a community, really promote that at all of our service providers, but we don't have that control.
Okay, thanks.
Second goal would be to make available no less than 4 training and mentoring opportunities for individuals with lived experience to be able to support increased participation in leadership. So we did partner with our statewide or our Balance of State organization on a statewide system improvement grant that we did receive for the state of Alaska that is going to create opportunities for youth with lived experience and expertise to be able to receive compensation for their participation and then also create training scholarship opportunities. So I'm really excited about that. And I think that's a good first step to being able to promote that system-wide. Next slide, please. Third goal would be to identify at least one funding source at each government level that we could use on an annual basis as a community for lived experience compensation. So right now we have a HUD planning grant that is eligible and able to be used for those types of compensation. As I just mentioned, that HUD Youth Systems Grant will also support compensation. And then we've applied for an Alaska Humanities Forum grant to be able to host some listening sessions that would involve compensation for people with lived experience participating in that. And then last goal is to create opportunities for those who are Alaska Native and who have lived experience to be able to connect with culture and healthy ways of being. So right now we don't have any specific opportunities created, but we have increased the partnerships with Alaska Native-led organizations to be able to start those conversations. Next slide. All right, and last section is increasing funding and coordination. So the first goal is to align our funding opportunities in purpose, application requirements, and timing to the greatest extent possible to be able to streamline and coordinate those funding opportunities and formalize those alignments. And so we're continuing to work with the Funders Collaborative. Earlier this year and late last year, we created a group that really brought organizations that are part of funding housing and homeless services here in our community together to try to talk about places where we might be gathering the same information in applications and how can we align some of that so that service providers have access to more types of funding and that we're not creating artificial barriers for people to access that. And then continuing work on aligning community plans. So working really closely with the health department to make sure that when we identify strategies and goals as a community through documents like Anchored Home, that when we create our plans at the municipal level for our participating jurisdiction funds, that we're making sure those are in alignment. And then there will be some HUD technical assistance available to help with those that work as well. All right, second goal would be to identify funding resources at the federal and state level that are outside of HUD, municipal government, and philanthropy that we can use for housing and support services. So the beginning work on that has started researching best practices, networking with other continuum of cares and organizations and talking about how they might fund things. Particularly Department of Justice funds are used frequently to fund some housing services, as well as USDA funds to fund some of the food and nutrition services that exist within our housing and supportive housing programs. So those conversations have started, and there's been a few resources that I know some applications are out, but I think it'll probably be a year or so before we see some of that start to come into practice. Next slide, please. All right, so data and dashboards. This was a kind of quick and dirty of the status of all of the goals at this first 6 month. So what we're creating on our website is a data dashboard. So this will be published by August 15th, and then it will be updated based on the timeframes that were identified in Anchored Home. So some of the goals are annual updates and some of the goals are every 6 month updates. But you'll be able to see all of those key metrics and then each of the 4 individual categories with all of their goals, along with narrative statements if it was something that isn't necessarily a number. Something I preach a lot is no stories without numbers, no numbers without stories. So it's really important to always tell show the whole picture. Next slide, please. So looking at priorities and challenges, I think as a community, a lot of conversation has happened around the focus on unsheltered homelessness and shelter strategies and plans. So working to ensure new and ongoing shelter services remain housing focused. They're connected with coordinated entry service and that they have equitable access for all. Addressing the encampments with partnerships with Parks and Rec and APD, having clear communication with each other, with other providers, and with the public so people can see what work is happening and where things are being addressed. Being able to support providers that have housing referrals to ensure everyone is document ready for housing. So one of the biggest delays right now is if someone gets a housing referral, but then they need an ID and they need a social security statement or they need pay stubs, they need a social security card. So what we're able to do is help make sure everybody has that information and that it's accessible in HMIS so that when that person gets that housing referral, they can move really quickly into housing. Next slide, please. Supporting the safe parking implementation for people who are using vehicles as shelter. So AO 2024-40S version was passed, which would support creation of safe parking. So continuing to have those conversations and help with that research. That would be able to be supported with street outreach services with known locations of vehicles. So people living in vehicles are really challenging right now. It's hard to tell where the vehicles are occupied. They move frequently. So having safe parking would really help with connecting people with resources. And then emergency cold weather shelter planning. It looks like we'll hear a little bit about that today, perhaps. But looking at likely 400 to 500 individuals needing winter shelter, including estimates of people who are likely to stay outside unless that shelter addresses barriers such as pets, family structure. So we know that there are barriers to entering shelter that exist with people who are unsheltered right now. And if the shelter doesn't address that, they're not likely to go to that shelter. And then looking at upcoming funding opportunities. The HUD Continuum of Care Notice of Funding should be released literally any day now. Last year it was early July. That will bring with it the opportunity for bonus projects. So people who have projects right now that would like to expand them or new projects coming on, there will be funding available for that. As well as breaking news, last Friday, HUD just released a new funding opportunity called COC Builds, and it's using the Continuum of Care framework to fund construction of new permanent supportive housing. So starting that research now, that application would not be due until the middle of November, but I'm really hopeful that our community can come together and put together an application and project for that. Next slide, please. And then looking at private and public partners, I just wanted to highlight some of the partner focus areas that ACH and the Continuum of Care have been working on lately. Looking at funders in private partner focuses, looking at different funders, partnering with the business community, partnering with faith-based organizations, community councils, and community members, particularly around that communication. A public partner focus with HUD leadership. There's a new regional administrator who we were fortunate to be able to host here in Alaska at a meeting. And then relationships with our local HUD field office, relationships with AHFC leadership, particularly around their annual moving to work plan, how they allocate voucher resources there. And then, of course, municipality leadership. And then focusing on provider partnerships with our healthcare providers, correctional institutions, child welfare organizations, behavioral health providers, employment and educational providers, and legal providers to be able to provide some of those referrals and wraparound resources for people who might have challenges to accessing or remaining housed once they have that referral and have that assistance in place. Next slide, please. I think that's the end.
Thank you. I'm sure there's going to be many questions. First, thank you for being here, and thank you for going through all of that. That was a lot of information. There's two things that I know that are coming. That is Spranger, you want on the queue? Is that correct? Yeah. One, and I know this is partly what Ms. Spranger shared with me, is the goal of this being the community's plan. Mm-hmm. And it was clear just from your presentation that there are parts of it that feel very much like the community's plan, and there are parts of it that feel a little bit more like the coalition as an organization's plan. And I'm curious about your thoughts about as this rolls out and as this evolves, how does this become a plan that the everyone can see themselves in, so that the administration sees clearly what they're doing and their role and their contributions. All the organizations, everyone, is there a process to reevaluate it, to check in on it, to shift it and change it, so that it evolves to being a plan that that the entire community feels like is their plan and that they have a stake in it.
Yep, absolutely. So I've always envisioned Anchored Home as being a bit of a framework of a plan. So how the community will execute on these types of goals, with the ultimate goal being reducing the number of people experiencing homelessness. So there are subpopulations. I'll just use, for example, families. So there is likely a much more detailed plan to be created that talks about the individual resources that families have available to them, the very specific challenges that families have addressing their homelessness. I think this is more of a framework to help guide development of some of those strategies. And I hope that it's there in terms of people finding themselves in there, where they can find where they partner in that. So if you are a landlord, you can find your spot in Anchored Home. Where do you play a role in there? For the municipality, for example, the municipality plays a bit of a dual role as a funder of a lot of these programs, but also as the organization or the framework of setting policy for the municipality. So when the assembly makes decisions or the administration enacts policy around zoning, for example, that's reducing barriers to creating more housing units. And so people might not necessarily look at it as something that exists in the fight to end homelessness, but ultimately, if there are more housing units available, there are more housing units available to people experiencing homelessness, and there are more resources for them to move out of homelessness.
Thanks. Ms. Braga?
Or-
Do you have a question?
Well, did you want me to bring up what I wrote now, or wait to see if new business we can talk about it?
So I will just say that would be a new item under new business. If you had a question specifically around the plan, that would be helpful. But yeah, I can bring that up as new business when we get there. Yeah.
No. Okay. I guess my only question for you is, I really don't, where in the plan that you have, could we see where people experiencing homelessness are putting some skin in the game, or finding movement toward independence? I think you mentioned one section of that, but I couldn't really see where I'm seeing in town is there's not a robust plan for how to make this, there be an end game, get to, that we're not continuing to bounce back and forth because there's not stable income possibility. So where do you think in your plan that falls in?
Yeah, so I will say the one very specific place I went when you mentioned this before was under housing, supportive housing and supportive services, Action 4, which is improving access to healthcare and person-centered supportive services as part of housing to help more people stay housed. So that goal, that framework is under the idea of housing first is not housing only. We don't put people into housing and then say, good luck. You have those wraparound services. Part of those wraparound services are connections to employment resources. If that person is not able to access employment, so some people have disabling conditions which prevent them from accessing employment, it might be accessing Social Security, but ensuring that they have some kind of long-term income plan to be able to support their needs. And their ability. Sometimes that's healthcare. If somebody, doesn't have the ability to perform their activities of daily living, those supportive services are going to be working to help them get to an assisted living facility or a personal care attendant that can help them remain housed.
And then the other question, I remember one of the first meetings I was on the body, members Alatel said, I don't want one penny going to anything but housing. And I think so I don't know if that's the coalition stand still, but I'm concerned with what we see on the streets in our parks. And if we don't put pennies into a continuum of pathway to housing, if we're not doing the designated camping spaces or safe parking, this is going to continue to look like what it does now. And in the parks in my area, it's not acceptable. So I'm hoping that that even though housing is your focus, that you're also, there's a recognition, because you mentioned safe parking, that we need some levels below that we're moving up toward the housing.
Yeah, and I would say and I'm going to kind of speak a little bit for myself here, I guess. I don't see it as you take steps to get into housing. Some people might have different stops. I call it people's housing journey. So some people's housing journey will be very short. They will enter homelessness and they will go straight back into housing. And some people's housing journey will be long, and they will have interactions with different levels of services within our homeless prevention and response system. But I can speak for the coalition as the coordinator of street outreach services that we provide lots of services to people that aren't housing. We are always working in that goal of getting someone into housing. So when we have interactions with people who are outside, we are saying, what are your barriers to housing? What is stopping you from getting housed right now? And how can we help you address those barriers so that you can access housing? And sometimes it's an ID. Sometimes it's something much more in depth.
Thanks. And I have another person in the queue, but I just building on this question, I think part of the challenge that I'm seeing is that, again, when you use the word we, do you mean the coalition as an organization? Do you mean the larger sort of body of work that is going on? And in the plan itself, there's not a section on abatement. There's not a section on emergency cold weather shelter. There's not a section on parking. There's not a section on the things that many of us see every day, and we're like, well, what's going on with that? And there was a comment, I think, at an earlier meeting where we said the coalition won't go into that camp because it's not safe. Well, someone has to go into that camp. Maybe that's the police department. So when there's an unsafe camp, where is the section in the plan that says the police department does this?
Yeah.
So that it's clear that all of those things are being thought about, and we're working on all those things, but one organization's not necessarily doing all of them. And so I think that's partly what feels, at least I don't know if this is true for you, what feels missing is that the plan does not seem to address many of the things that I think at least the constituents that I speak to are curious about. Well, what are we doing about that? What are we doing about fires? Is there something in the plan about that? So anyway, that's just feedback, I think. And I think that the goal from my perspective would be that whether it's the plan and then as a framework and then there's a larger plan or however we structure it, but that we get to the space that there is a more comprehensive document that everyone can see. That's like youth. I see Covenant House in here. Is there a section specifically on here's what we're doing with youth, right? So that's what I'm hoping for, is something that can feel very much inclusive. Do you look like you want to say something? Do you have a comment? No. Okay, good. You can respond to that, but I think that's I think what I'm feeling, and maybe Ms. Bronga is sharing as well.
And I will say that particular we was the coalition, because the question was about the coalition specifically. Sometimes I am referencing the community at large or the continuum of care. I think this plan very specifically doesn't want to get into places that it doesn't belong. So the municipality has code that outlines how abatement happens. So this plan should not dictate how abatement happens. That's not the role of the continuum of care. The role of the continuum of care could be to provide advice or to provide insights if the code is being opened and we're having conversations about abatement. But really being cognizant of where there is influence and where there isn't. And then I would just say exactly what you were saying. I think that thinking about this framework and thinking about where there might be more specific plans that deal with more specific issues would make sense. And if there is a goal that is create X number of shelter beds, for example, that would be appropriate to be in here if that was a goal of the community to create additional shelter beds.
Yeah. Well, and I appreciate that. And I think that's why it's an open discussion about what is and is not appropriate to be in there. And I think that we can debate that. So any other questions for the coalition? Miss Raleigh. Thank you.
Yeah, I was in the queue.
Oh, sorry. Go ahead, Chris. You were first, and then I'll have Miss Raleigh go next.
Yeah, thanks. A couple of things. First, I wanted to say, and maybe folks will turn off their mics. Um, previous the previous version of the anchored home plan, it was a really clear lane called out for the municipality, and that was the public safety, public health lane. And I don't know that that serves us anymore, or it actually worked out really well in the fullness of time and looking backward. But a lot of this conversation is about what is the municipality's lane. And I think that that's something we need to sort out as a body, and with the administration coming in with their leadership to tell us what their thoughts are. I can say that the phrase "skin in the game" often is used, and I'm not suggesting a member did that, but often is used as code, which means effectively punish them into action, move them by force. They must pay or we will evict, like heavy-handed movements. And what we know, at least those of us who've been around long enough, is that what actually works is providing resources and motivating people to move towards better choices. And so this hammer versus stick conversation is as old as time. And some of the public safety requirements we have to ensure when a place becomes unsafe, that it's mitigated, it becomes safe. But the issue of vehicle parking or a publicly sanctioned camp is not something that I would expect the anchored home plan to address at all, because we have not come to a point on that ourselves. We've had that debate probably 4 times, and it's never come out the way that the advocates have wanted. I believe it probably will soon. Some of us are, moving out off the body with kind of the fullness of time, and this kind of argument might actually win the day soon. But there are many of us who believe any investment outside of moving people off the streets and into housing is in fact a waste. I would hesitate to put words into other people's mouths, though. So for my part, I think that the question is for us, what is our lane? And then we can document that however we choose to, that complements this anchored home plan, or that says, now that we've adopted the plan, we've rethought, we don't want this part or that part, but ultimately our action should speak to our lane.
Thank you, Mr. Constant. I have next Ms. Brawley and then Mr. Rivera.
Thanks. Yeah, and I appreciate the discussion. And also kind of looking back to the prior anchored home, I think one of the weaknesses of that plan, other than, that it was a few years ago and this community has come a long way, is that it had a very long list of actions or strategies. It did have some assignment of responsibility, but maybe not enough, right? So I think this moves further along and is much more focused. But I guess 2 thoughts on that. One, I do appreciate the discussion about what the Muni's role would be and what that looks like, and that there are things where that is not where the coalition's leading, or really not where the full community leads, right? Things that are the city's responsibility. So one thought would be, as we move forward, not the assembly developing it on our own, but that the Muni, the assembly, and the administration could work on basically a supplemental sheet to this, right? Kind of clarifying those things, maybe in a work plan, right? Something in more detail and with a little bit more specificity. So that would be of interest. And I don't know, I guess I have 2 questions for the coalition, so I'll state both of them. If that's already been in discussion, or where you could see that fitting into this plan. Again, not opening up the entire plan, but how do we supplement it without creating a confusing set of documents, right? So that's one question. The other question is kind of along those lines. There are certain things that the Muni is funding now, and has funded through alcohol tax, for example, and now some funding for shelter in our general fund as well. So not something to answer today, but I want to raise the question, and again, see if there's initial thoughts on it from the coalition, what that might look like going forward as we at the assembly level discuss our alcohol tax plan and looking ahead to our budget, and really just thinking longer term, that because we don't want to be in this situation that we're always funding on an emergency basis, right? But it's going to take time to get there. So that's really my questions. And then if the administration wants to weigh in as well, but really both of these are longer term discussions. But one is, how do we supplement this plan? Second is what kind of funding requests might come forward, or what do we think of there? Thanks.
So I can speak to my kind of initial thought on the first one. And I think your strategy around work plans is right. So 2 years ago, when this community decided to stand up a different type of family emergency cold weather shelter, one of the things that the coalition worked with all of the providers to do was create a work plan for what that looked like, so that we didn't have to act in an emergency status the next year or the next year, that we had built this framework for how that works. How do the referrals work? What happens when somebody doesn't show up, all of those things that wouldn't have necessarily made sense if we had had something called like the Family Shelter Strategic Plan. It wouldn't have made sense to live in that plan. It lives in this living document work plan that you can constantly adapt based on what's coming in and out. So when it comes to supplement things like that, I think work plans are appropriate because those are a little bit easier to come through and adapt as your situation changes or as the environment changes. On the second one, I think that one's a little bit more challenging. I think that I think it has to do with really setting policy and setting what your goals and your strategies are, and how do we want to be able to support that as a community. So, recognizing that there are a multitude of funding sources that are available to fund various things. Like I said, I think there's some untapped funds out there when it comes to Department of Justice or USDA funds to be able to help fund parts of different things. And so we don't always have to say this funding source funds the entire project. I was very fortunate to be able to be at the ribbon cutting for the Providence House, Providence Permanent Supportive Housing. And I don't know if you listened to how many different funders played a part in that, just in the construction of that project. And that has nothing to do with the ongoing operations, which has a stack probably just about as large. So recognizing that it's very difficult to have a project that is funded all one way. So you really have to be creative and strategic about how you blend all of those things and braid all of that funding together.
Thank you. I have Mr. Constant next. I just want to give a time note. I want to make sure there's enough time for the administration to speak and also for us to create some space for audience. Yeah, I meant Mr. Rivera. Sorry. Next in line is Mr. Rivera.
Yeah, thank you, Mr. Chair. So a couple of questions for the coalition, Ms. Parks. So I want to take folks back to page 1 of the document, which I assume everyone has in front of them, which on my PDF version is page 4, but it's numbered page 1. And I think this page does, I think, a good job framing, and I appreciate this discussion of sort of what's in the plan, why, what's not in the plan, why. And I think there's one critical piece that I would like Ms. Parks to opine on, and that is, in particular, how the plan aligns with some of the federal goals and investments in the federal strategic plan to prevent and end homelessness. So can you just speak to why the coalition decided to use that as a framework is my first question.
And just a clarification, folks don't have the actual plan in front of them. They have a slide deck, so it's not in front of you. Thank you.
All right, thank you. I think the short answer to that is we wanted to ensure as a community that we were aligned with what the best practices at a federal level were, but we wanted to make sure that we allowed the room for ways that Alaska's different and Anchorage is different. We know that a strategy that is successful in Louisiana, for example, may not be as successful here in Anchorage. So we want to have that ability to be able to customize the approach. But the overall framework in terms of the key metrics, for example, that comes straight out of the federal strategic plan. These are all system performance measures that all of the grantees that receive HUD funding are required to track and report on. So this is how we ensure that our community continues to be high performing and continues to get the maximum resources available to our community. So the way we get there is flexible, and different providers are always going to do things differently. But the end goal of reducing the number of people experiencing homelessness, reducing the length of time people experience homelessness, and reducing those returns to homelessness are going to be really those catalyzing goals that Anchored Home will have.
Mr. Rivera, you got a second question?
Great. Yeah, thank you. Yeah, no, I appreciate that. And I think that folks can turn off their mics in the room. Thanks. And, I think that really goes to, a lot of the rationale for why this particular plan is structured the way it is, and the goal, right? The coalition has not been shy about how it's focused on a particular goal. It's not that other work is not important. And in fact, that leads to my second question. So outside of this plan, the coalition does a lot of other work. So has the coalition provided advice to the administration on abatement? Has the coalition provided advice to the administration on designated safe parking areas? Can you just speak to a little bit of some of the other work that you are doing that maybe isn't part of this plan?
Yes. So I get short answer, yes. The coalition provides a lot of feedback, a lot of advice, and is part of a lot of conversations around how particular policy decisions that are made by the assembly might look in execution, particularly things that intersect with street outreach, since that is work that we do and help lead for the community. We have been part of conversations around changes to the abatement code, in-depth conversations about activation of shelter over the past 3 years. We, as an organization, led the task force work of the 2 emergency shelter task forces that were stood up in the past 3.5 years. It all starts to blend together after a while, as well as providing feedback at any time if there's ever questions about how something might be executed or how a project might be put forward. The technical assistance that we provide to community members and providers who are looking at projects. The In Our Backyard project with Central Lutheran, we were part of those initial conversations about how that could be structured, what funding it would be able to access if it structured itself in a certain way. We provide a lot of that feedback.
Great, thank you.
Thank you. I see no one else in the queue. Before I let you go, just wanted to sort of circle back to this idea of a plan, and whether that's a plan with multiple parts, work plans, pieces, that it feels really, really, really important, because what I see, and when someone says, well, that's not the community's job, that's the municipality's job. We are the community, right? We're all part of the community, right? And we're all play different parts in that. And so, when you say, well, there's a medically fragile particular part of that, well, that's someone else who does that, right? So in that plan, at some level, has to be a way for us to capture all of these things that are relevant to the work of ultimately getting all of these folks housed. And so however we structure it, I think it's really important. And I want to thank you for being here today, and thank you for presenting, and thank you for the work that you do. Okay, great. All right, we're going to move on to our next section, which is the administration. And I'll just say that from my perspective, the goal here was to just introduce yourself to the committee as a new and maybe not so new, and also at this point, just where are you at? What are your thoughts? What are your plans? I think that the pressing issues that are coming to at least this committee leadership are issues around abatement and camp management, obviously, planning for emergency cold weather shelter, and then just sort of an initial thought about strategy around sheltering in general. And so, but those are just things that I think are priorities in our mind, but would just love to hear where you're at, introduce yourself, and talk about your thoughts and plans over the next few months and year.
Great, happy to. I'm Katie Skovic, Chief of Staff in the Mayor's Office. As you mentioned, fortunately, we have other people coming on soon to direct this work out of the Mayor's Office, so that's the good news, and I'll be our representative for today, and I'm here with Eva Gardner, Municipal Attorney, Mike Braniff with Parks and Recreation, and then we also have folks from the Health Department and the Police Department in the room. So first, want to say thank you to everyone who's been doing this work and doing a lot of hard work, and I'm just going to start by doing kind of some big directional updates. I assume that you all will have specific questions and there's a lot we'll tease out, but that also probably part of the goal is just to hear from the new administration about where we think we're heading and how we're viewing these issues coming in. So that's what I'm going to do. And I'll start with, I think the two things we were asked to speak to are abatement and shelter. And I guess I'll start by just saying that I think Jessica put this probably more eloquently, but the administration shares a goal and a focus on housing and services as the solution to homelessness. We're also going to be prioritizing shelter as an emergency response, in particular recognizing the number of deaths from exposure that our community has seen and knowing that this has been a gap in the community. And then finally, we'll talk some about abatement today, and this has already come up a little bit in this conversation about where homelessness and public safety come into contact with each other and what's the municipality's role, and that's very top of mind for us. So the mayor has said many times that she views public safety as the number one job of local government. So just to sort of restate that priority, and we know, all of us in this room, that there are big issues of public health and public safety playing out in our streets, along our green belts, and so there are some of these big issues that we need to think about. We know these issues have serious impacts for the people camping, for neighbors, for businesses, and generally for our public safety and well-being as a community. So first piece we were asked to speak to is abatement. We know that abatement is not a solution to the experience of homelessness. It's a tool that moves people around, and it's sort of a tool in the public safety toolbox. And so we want to talk about that, but also just to state clearly that we don't see that as ultimately a solution to the experience of homelessness, which we again see as we need to focus on housing and services and shelter and making sure people have places to go and ultimately getting to a point where fewer people are camping in the first place. Also, just to say, we're excited about the work happening with the Next Step initiative, which is able to take people from an experience of unsheltered homelessness into housing. Our understanding right now is that that program isn't at a scale where it is a full response to encampments. And so we know that we need to sort of think about that in tandem with the camps that do exist in the community. I think one thing I wanted to point out, I think you had mentioned this, Assemblymember Perez-Verdia, is we've seen some camps, and this is maybe an example of sort of a potential tipping point where service providers and outreach workers no longer feel safe entering into a camp. And that's a point at which we've really lost our ability to connect people camping to any sort of shelter, housing, support. And so we've been just talking on the administration side about what camps currently exist. What are those criteria or factors that point us to a camp that has reached a particular level of crisis? And so wanted to just provide an update that that's what we're thinking about, and also to share, I think because this is a good example that Fairbanks Street is a top priority as we look at potential upcoming abatements. That's an area that has reached a level of public safety threat that we feel needs to be addressed. High numbers and high levels of criminal activity, including a shooting that resulted in a death. There are people camping in the middle of the road. We've had, as I'm sure many of you have had, significant outreach from the community, from business owners about impacts to safety, about very significant financial impacts. And this is a camp that has existed for over 60 days at this point, and the trend lines that we're seeing suggest that it is only becoming more dangerous and not less dangerous. And so we see this as an area that's not safe for campers, it's not safe for the neighborhood. And so this is sort of risen to a level of priority for the administration. And we'll have more to share on that front, but I think that's both an update and an example of some of the factors we're thinking about when it comes to looking at camps and the intersection with significant public safety and public health risks.
I have a question for you.
Yeah.
Ms. Braga.
So maybe you're going to get to this, but abatement with nowhere to go just pushes it to another neighborhood. And so hopefully there's some enforcement or a place that we're going to have supervision and get better control of. Thanks.
Yeah, and I look forward, and I think we all do, to talking more about what this piece looks like. I think we've had discussion about camps that have reached a level of size and scale and criminal activity that potentially even just being able to disperse that situation is itself a positive outcome. We need to talk about what happens from there, and we should, but just to say, I think those are questions that we're asking and looking to answer, and look forward to working with you all on that. Maybe last piece, and then I'll pause and can share more on shelter as well, is when we think about abatement, we're also thinking about not just policy and goals, but the process on the administration side. And so we're committed to having a unified process with a dedicated point person that lends itself to clear communication and consistency when it comes to how we approach abatement. And so I think we've heard loud and clear from the folks in this room, from partners, from the public, that that's really, that would be really helpful. And so I think just to say, maybe we're taking this seriously. We want to do it right and do it thoughtfully. And so that's where we're at. There's a lot more to do, and there's a lot that's already happening, but that's high level status update. And welcome others on our team to add.
Just a couple of notes, and then I'd love to hear on the abatement. And it's interesting because I actually was writing this and I thought of abatement / sort of camp management, right? Because it's what are we doing about the camps, what I'm hoping for is some real clarity about why we abate, when we abate, what the process is to determine that, so that the public can be really aware of that. And we recently had a meeting with a group of community members who were really concerned about a camp in their area and had seen criminal activity and had seen things that were more than just folks trying to survive in this space. And we had an interesting discussion about, okay, well, what is that threshold? And so the more that we can be really clear about that and communicate that to the public, the better. And I know that the Assembly passed some work in ordinance to give you hopefully more tools in order to make those kinds of choices. But pulling that out of the sort of the back scene and making it really transparent in terms of when and how and who and why we abate, I think would be really helpful. So.
Yeah, I think for now, I'll just say we're aligned in that goal of clear process and communication.
So else you have the questions on abatement, so we can move on to the next item.
Maybe if I might, I'll just add one tidbit. I think with your question, as you think about Fairbanks Street, what you're thinking about is selecting a safe parking site, as we've identified the need to. And while I'm unable to give you an update, I can tell you that work is actively happening in the health department right now. So like I said, I can't provide you an update, but I know the work is happening. So yeah.
Thanks. And just for the record, I was reminded to please state your name for the record as you speak. Thanks. Go ahead.
All right, we'll do part 2, which is on shelter. So I think just again to start with kind of a statement from the mayor. She's stated clearly, which I just didn't, that Anchorage is a winter city and we must have sufficient shelter, particularly in the winter. She's also committed to a year-round funded shelter plan. Timelines that we've talked about is a winter shelter plan ahead of this winter and a year-round shelter plan. That means we're not in the same cycle of stepping down shelter in the kind of shoulder season or spring. And so we're, immediately looking at winter shelter. And then from there, how do we build a year-round funded shelter plan? I think the shelter at East 56th has been a good example of how we move toward stable, sustainable year-round shelter. And I just want to thank members of our team and also of the assembly for making sure there's not a disruption in services at that site. And so we share that same goal of, as we look to add more shelter, retaining the existing capacity that we have is an important part of that strategy. And then this will be just a big picture update for now. I think as we have folks coming on, we'll have more, the first week or two of August is when we'll be really diving in terms of winter shelter planning. But we've had a transition team convening since early June of community leaders, experts. The initial findings of that group point to a path forward that prioritizes smaller shelter sites, not a sort of single mega shelter or large shelter location. That's a priority that's in alignment with the administration. And my understanding is that we're talking about identifying shelter for about 500, maybe it was 450 to 500 or so folks heading into the winter. So that's the scale of the problem that we're looking at. And that's the approach we'll be aiming to take. And then obviously want to be doing this work in coordination with partners, with providers, with the assembly. And I think to that point, just want to say that we don't want to start from scratch where we don't need to. I think we've seen over the past several years sort of a restarting of a process. Jessica spoke to this, of how do we sort of get out of that cycle. And so if and as there, from partners, from the community, anyone, if there are documents that you want us to be looking at, and obviously we have some of those in our departments as well. But I know there's been a lot of work in the past to vet shelter sites, to think about what are priority services that would need to be funded for shelter to be successful, et cetera. And so those are some of our big picture priorities heading into the winter, and then really open to working from existing models as we build out that plan.
Great. I don't see any other questions around that. I would just, again, repeat what I said before. I think in the previous administration, it felt like the word plan had a different meaning. And I think what we're moving towards is really thoughtful planning that's co-created and that is tangible and clear and all of those things. I think will solve a lot of our problems. Is as you come out with these plans for camp management abatement, plans for cold weather shelter, plans for shelter, it helps to communicate really clearly to the public what your intentions are, what your goals are, what your timeline is, all of those things. And then it creates a way for us to, I think, act in a coordinated way. So I hope we're on the same page of what we mean by a plan now, and that we can actually start to create those and even create drafts of plans and get them out to the public and get feedback from them, and bring some of the people who've been around a long time and have been involved in this a long time, give them something to react to. And that it's not perfect, but at least you're getting your thoughts out there, and then we can get feedback from it. So the sooner you can put together something that is a draft plan, and we can start to wrestle that and work it and that sort of thing, I think the better. So, yes, Ms. Braga.
So this might be a question for Mr. Braniff. Are we passed a resolution ordinance that had an abatement priority, and are we following that at all? Like, we specified things like so many feet from a body of water, or so far from a school or daycare center. Is that being followed at all right now, or we're kind of in that transitional? It's okay if we're not. I just wonder if it is going to be, if it helped at all.
I'll take that question if that's okay. Eva Gardner, municipal attorney. So right now, my understanding of the abatement process is that it is attempting to harmonize existing administration policy with that ordinance. And so it is a holistic look that takes that into consideration. And I think one thing that we are excited to do is to work with you to bring those two things, administration's policy and code, into alignment with a more, nuanced, informed, humanitarian, practical approach to these problems.
Thanks very much. I think the last piece we wanted, and I really do want to make sure we have time for audience participation. But Ms. Resch, will you come up and just share? I wanted to have a few just quick updates on budget and finances related to this committee. If you can give us a few updates, I would appreciate that.
Yes, Kimberly Rash, Anchorage Health Department. All right, so there are a few things I just want to touch upon in regards to budget. So as of right now, we currently have the two contracts, one for the shelter operations and one for food service, which will go until October 15th, 2024. We are planning on putting out 4 RFPs, one for non-congregate sheltering, one for congregate sheltering, one for food services, and one for third-party oversight. And that is in preparation of the upcoming emergency cold weather shelter season. And so we're hoping to get those out on the street for August 1st. That is an aggressive timeline for many departments within the municipality, but we are hopeful that we can get it out there, have it out there for 30 days, and so that the contracts can start mid-October. As we know, we currently have, or we will be receiving the $4 million from the state of Alaska. And so we have put an appropriation document. It's currently routing, so it should be on the agenda on the 30th, so that we can get that in place so that when we do receive the funds, we can start to utilize those. In the meantime, we do need to figure out some bridge funding. So thank you to members of the Assembly and the administration for bringing that forward. We have located some funds for some bridge funding for August 1st through the end of August. And what that looks like is utilizing funds from ARPA that were received from UAA. So they were returned back to the municipality. We currently have within the health department, we had utilized some ARPA funds in the past, so it makes it a seamless transition. Those funds that were returned do have to be utilized by 12/31, and so we felt it best to utilize it in this capacity. We're hoping that this document gets before the body next week on Tuesday's agenda. It's a little over $890,000, so it will require 2 meetings for that. In regards to upcoming funding needs, I think that's going to be really determined by the RFPs and what that looks like after that process. And so I think we can continue to have those discussions and just be really aware of our current structure that we have in place with funding and as we move into the new year. To kind of go back a little bit in 23 and 24, I just want to kind of highlight the way that we were able to braid a lot of funding. So in that shelter season, we use alcohol tax funds, we use operating funds, we use ARPA funds, we use some grant funds through the state of Alaska, Healthy and Equitable Community Grant Funds, as well as some HUD funds. And so that was just, I think, a really great way of being able to pull in different areas to make sure that the season was as successful as it could be with the funding aspect. Another thing I would like to quickly touch upon is there was a document that should be making it your way, which is a declaration of Title 16 activation. So as we know, Title 16 activates when temperatures dip below 45 degrees, but once it hits above 45 degrees, it ends. And so in order to continue the sheltering year round, this activation allows for that. So as acting health director, I have activated that plan. It is retro back to May 1st, and it will continue to be in place until the temperatures dip back below 45 degrees, in which it will automatically be activated. And so kind of just that high level of the funding for sheltering. I know that there was some item on here for ACH funding. So currently in 2024, ACH does receive some funding from the health department for street outreach, their Next Step pilot program, and then through some funds through emergency rental assistance. And so we are still working through that with them on the ERA funds. But from what I understand, everything else is on par and being utilized.
Thank you very much for being here. Appreciate it. Okay, I want to make sure do we have members of the audience that would like to speak? Looks like we have at least one. Okay, if we can set up a mic, please. And before we do, just closing, any final comments from the administration? Anything you want to share before we close that part of it? Are you all good? Okay, great. Okay. And so I'm sure you know this. You'll have 3 minutes to speak if you can share your name and where you live in Anchorage. And your time will begin. I think there's a timer that'll be up on the screen behind me. Great. Go ahead, please. Oh, your mic isn't on, ma'am. You have to. There you go.
Thank you.
Thank you.
Hi, my name is Chris Stoner. I'm president of Midtown Community Council, and I'm speaking on the behalf of Midtown Community Council. First thing, I have to disagree when people say it's going to take time to do things. We need to do things now. We need to start working now. We have a camp on Fairbanks Street that is so dangerous, the coalition won't go in. Most of the city people won't go in. The police do go in. I go in. A couple other people go in. But it is very, very dangerous. We cannot allow this in our community. Midtown has been hit for the last couple of years, I think more financially than any other area in town, because we had the big camp at Cuddy and now we have this camp. What happened is people moved from the Sullivan. They were actually told to go to Cuddy by some people. They went to Cuddy. It got crazy. We finally abated it after the winter. They went 2 blocks to where they're at right now. And this is just intolerable for our area. We have lost millions and millions of dollars from theft and vandalism and other things. We have human waste on the roads. We have motorhomes who dump their waste underneath them. We have needles. We have a lot of needles. One of the hotels had to hire someone to clean the needles up off of their area. We have small children in that camp. We have an 18-month-old baby in that camp. We have another child who rides a bicycle in the camp, probably 6, 7 years old. We have guns, knives, machetes, on and on. We had a chop top. He was gone today, thank goodness, but somebody else will probably come out. We have a young woman who's really cute, really presentable. She stands on one of the corners quite often with no shirt on, and she'll stand on the corner quite often with no clothes on. In my opinion, and I'm not a professional, I think she's mentally ill and she needs help. We have gang action in that camp. We've had a murder in that camp. With the same group of people, we had a murder over at Cuddy. We have ODs in that camp over and over and over again. I actually assisted in helping a gentleman yesterday. Abatement is not a solution to homelessness, and I do agree with that. But we've got to abate this camp. We've got to break it up somehow. We have spent years talking about this, and we still don't have a place for people to go. I'm going to suggest Elmore and Tudor again as a place. We could put gravel down on that area, and you could have a sanctioned camp in that area and abide by the numbers of what you all passed a couple of weeks ago. We've had 60 days of that camp, millions of dollars in damage.
Your time is up, ma'am.
Yeah, I appreciate you guys. I just want you to know I do appreciate you.
Thank you. Thank you for your testimony.
And thank you for listening to me.
Sure. Next person, come on up. Share your name for the record and where you live in Anchorage, and your time will begin.
Yeah, thank you. My name's Kenny Peterson. Live in Midtown, and I just want to say thank you. From this meeting, the questions that are asked, the things that are presented, the plan, the vision, Ms. Gardner talking about humanitarian as response and abatement, all the efforts that are going on that I've seen. I spent a lot of time down at Fairbanks Street and other areas for it today and in the last couple of months. And the response that's happening, there was a team down on Fairbanks Street picking up trash today from the city, made a huge difference. And so I have more hope now with this group that's speaking, with the new leadership here, with Farina coming on, with Katie and her experience, and Mike. And it's just amazing what is the potential what we see. And I just want to say thank you. You guys are doing a great job.
Thank you for your testimony. Next person, please. Yep, come on up. Name, where in Anchorage you live, and
Yep.
your time will begin.
My name's Allison Kerr. I'm CEO of Covenant House. I live in Midtown and I work in downtown area. Kenny got to do it first, but I agree. Thank you, because I think that there is a lot of traction, a lot of forward momentum on things. And I know that every day I get to see young people at their best. And often what the public sees about even young people is not at their best. And so the patience and the tolerance that it takes to work through the trauma of homelessness, I'm just grateful for. I will say a couple of notes. So one, I appreciate finding money, right? Like the comment, we were able to identify some money. I'm an organization that the money wasn't found, but the service was delivered. And it was caught between what may have been promised, what the assembly was able to find, but we delivered the service. We delivered the shelter, we delivered, and we ended our fiscal year about $250,000 in the hole because of delivering that service. So I would contend if money is found, maybe look back to on the organizations that it wasn't found for at the time that the service was being delivered, because it sure makes it difficult to stand up and do that again. And I've already received calls like, are you willing to do emergency cold weather? And it's just really difficult. And I also would appreciate the fact that there is money coming in for emergency shelter. I've been a part of running emergency shelter for 20 plus years. And I'm grateful that a source has been identified, but I don't believe it's fair when a contract can be made and there's no match required. And so 100% of that service is being paid for when dollars should be leveraged by every organization, just the way a contract is negotiated on any other points. So when, and I've been told that it's a policy, a municipal policy that's not requiring that, I really do think that organizations also should help leverage the resources to deliver the service. And then that way the money goes further. It allows organizations that aren't receiving that to be able to leverage some resources. So I would ask that you guys reconsider maybe how some of those contracts, and not just look at low bid, because low bid does not always give you the service that you need. And when you have an expectation that this is the way that we're going to show this community how this service can be done, I wouldn't just look at low bid, and I would just encourage you to think about that. Thanks.
Thank you for your testimony. Would anybody else like to speak at this time? Do we have anybody on the phone? No. Okay. Yep. Come on up. We just have a few more minutes. Share your name for the record, where you live, and you'll have 3 minutes.
All right. Okay. Jamie Lopez, live east side of town, was formerly homeless, managed to get out of it. Built relationships, a lot of different churches around town. I was taking food to camps 5 to 6 days a week. Literally by the end of May, I was feeding over 350 people a week in town. Worked for the coalition in period, know some of the people there. I can attest to the previous speaker talking about low bid. I literally had people coming from CWS to me to get food because the food there was so bad. They were getting a cup of noodles, cup of oats for breakfast and lunch, along with a granola bar, and small little tray of food. People were getting food poisoning, and yeah, it was not good. There are a lot of other things you can talk about. Yeah, I can say this: most of the providers, they don't go beyond the parking lot. It's a green zone, and they treat the rest like Fallujah or Iraq. I was literally going tent to tent to tent, RV to RV, getting to know people. And if you show up, if you act in good faith, you get to know people, they'll leave you alone. And if you do it long enough, you build relationships and they will protect you. It's just one of those things where you have to be willing to go out and meet them halfway. And, there are cycles of trauma out there. Pretty much 4 classes of homeless. You have mental illness, you have substance abuse disorder, you have people who fall into it for any number of reasons. It could be financial, medical, serious bad events, dominoes. That was me. And then you have, people who want to be homeless sometimes, or people that have given up. It's like PTSD. They've been failed by so many people in the system that, they've just given up hope. And so it's sometimes unconscious, sometimes it's conscious. And you see it happen a lot. A lot of times, okay, I could talk about this for hours in volumes, but obviously it's 3 minutes. CWS last year, there were two ways you signed up. Either you called 868-5329. You got ending on the phone, 9 to 5. If someone picked up, other busy, or, voicemail or voicemail full. That was one way to do it. But homeless phones, lost, broken, stolen, not charged, assuming they can afford the phone at all. Most could not. And then another way is you went to a coalition event. 3 hours they're there. Again, half the time, homeless don't know what day it is, let alone what time of day it is. And so I might have been there with a tablet signing people up. Well, I looked at that and I said, they still don't know what time of day it is. So, I was going to camps 6 p.m. to 2 a.m. at night, signing people up 10 to 10 to 10. And did it like Groundhog Day for a period of time. And then I left there. And then 7 months straight, I was literally paying to take food to camps. Housing may be the goal. You have to stay alive long enough to reach it. And that seems to be lost right now. And people could do a lot more. Sorry, my time is up. If you want to talk to me about any other things, I'll stick around at the end of the meeting. Thank you very much.
Thank you very much for your testimony. All right, we are at time, folks. I just want to thank everybody for being here. Thanks to the administration for your presentation, the coalition. We are adjourned.